Have you been told that you have to live with chronic pain? Do you have nerve pain going into your hands or feet? Do you have loss of mobility of any of your joints? Hi, I'm Dr. Mark LeMay. I'm a chiropractor and an applied clinical nutritionist. And today I have a good friend and colleague, Yvonne Ray, who's going to be here telling us about what she does because she specializes in microcurrent therapy for chronic pain. So thanks for being here with us today, Yvonne.
Dr. Mark, thank you so very much. I'm excited. I love talking about microcurrent and nutrition, and I'm excited.
Well, good. I'm glad to have you here today. Now, just to let you know, Yvonne is former military. She's worked in several naval hospitals in the past. She's also a pain specialist in 2 clinics here in Sacramento. And what I wanted to do is I wanted to have her come here today and kind of explain to you what she's told me. So I want you guys to find out, how does microcurrent therapy with, and if I remember correctly, it is basically biofeedback, so it helps you to kind of figure things out for patients. I wanted her to come here and explain to you what that is. So, Yvonne, in a nutshell, what is microcurrent therapy?
Okay, in a nutshell, microcurrent therapy, microcurrent is an electrical current that we have in the body, and microcurrent therapy is using devices that help us attach onto that electrical and look for any blocks. So much like an EKG. An EKG goes, 12 leads, they put it on, and they're looking for electrical blocks somewhere in the body, going out to the furthest regions and then back. So microcurrent can find an electrical block, like in an injured tissue, a knee, a shoulder that maybe is not resolving itself.
Even same thing like with the nerves, correct? You can pick up electrical blocks in the nerve.
Yes, electrical blocks in all tissue. These are tissue specific. So whether the electrical block is in the nerve, the muscle, the bone, the tendon, the ligament,
wow,
it can find it.
Yeah. Well, that's great because I know about blockages in chiropractic because that's one of the main things that I do all the time is help people with nerve blockages or joint blockages. So how does this device find in the blockages? How's it finding them?
So it's tissue specific. If we understand electrical, everything is created through a frequency.
Yes.
So the different tissues are like radio stations, right?
There you go. Radio stations.
The radio stations.
Changing the stations.
Exactly. They're on a different frequency. Well, every tissue has been researched, and each one has its own frequency.
Interesting.
So I can tune into, any one of your tissues, even your organs.
Okay. Well, because what it sounds like with this type of device right here, you can go in and basically you find the blockage, so you can detect the blockages, and then you can actually go in and correct those blockages. Is that what you're saying?
That is correct.
That is one of the cool things about this.
Absolutely. Yeah. And that would be the biofeedback portion. What's really important to understand is any engineer can create a microcurrent. It's that simple, they say, but a microcurrent with a biofeedback, again, allows the body to connect with the brain, and then we can see, as we're treating the tissue, how the body's responding. It is calculating. This one can calculate up to 3 million signals per second.
Wow. Well, I know because when I was in chiropractic school, they showed us, this is 40 years ago. Microcurrent units back then. You use these ones where you put the pads on there with the electrical leads, and it was basically just for healing. That's all it was for. This sounds like it is way different than that. So this is, because I'm sure in 40 years they've really improved things like that. It's not like the old microcurrent units that I was used to, right?
Oh, thank goodness for technology.
Yeah.
So a lot of what you're referring to, many of us may have tried. First that came out was the TENS units.
Right. Those are electrical muscle stimulants.
Exactly.
Transcutaneous electrical nerve stimulation. That's what it stood for. Yeah.
Yeah. And while those can and have helped people with pain, they're only doing one of two things. They're either one, blocking the nerve signal, so there's no tissue resolve, there's no tissue regeneration, there's no real healing, Or the second one would be, like you said, the muscle stimulator.
Mm-hmm.
With a microcurrent with biofeedback, it's on the same body wavelength as our body, whereas a TENS unit is 1,000 times higher, kind of like it's screaming at the body.
Yeah.
And it's also, like I said, on a different waveform. Our waveform, as you remember, is sinus wave.
Right. Do you remember? And it's interesting because, you know, when you talk about those different things like the microcurrent versus the TENS unit, I know like right now it's like, you know, it's July and it's like everybody's out at the state fair and people are out there, they're buying, there's different, you know, TENS units out there, or also buying them online too, because they go there, they check it out, and then they go online too. So like, so these are a lot more sophisticated than what you're seeing out there at the state fair or even online, correct?
Absolutely. Like I said, so you literally have a computer chip in here.
Mm-hmm.
And imagine something that 3 million calculations per second. It really is assessing the tissue in the moment, you know, of treatment.
Yeah.
So in the moment, it's telling me what's going on. And it also has the capability to connect with the brain. So if the brain does not get involved with the condition, especially if it's been a long-term chronic condition, your healing will take a lot longer. The brain actually has to be involved for healing.
I know that this can treat other things because I've told
Yes.
people, like, I mean, it can help like with like some dizziness, vertigo, those kind of things, which people would be like, what? You can help with like vertigo and dizziness? Yeah. I know there's some other areas too, like can work with kind of like gut health too.
Yes.
So why don't you tell us a little bit about that?
So a lot of that has to do with understanding, not just having the device, but understanding how to use it.
Mm-hmm.
So I have been trained with the Haché protocol, and Dr. Haché worked both with Russia and the cosmonauts as well as NASA and the astronauts. Now imagine this. You've got to go into an area and you cannot use surgeries or pharmaceuticals.
Nope,
right?
Can't do it up in space. Too messy.
That's where the beauty of this is coming from. They had to design protocols that would work for, I mean, everything from autoimmune to, you know, lung issues, urgent or emergent issues. Like you said, we see a lot of gut health issues.
Yeah.
Imagine
I do
if,
too.
well, and imagine you're
Yeah.
giving them all of that nutrition, which is the actual rebuild. Microcurrent cannot rebuild anything. It can repair,
right?
But it's the nutrition that does the rebuild, period. We're just taking those burdens off the body. You know, have you ever worked with somebody that you knew was supposed to be getting these results that are typical of your protocols, but for some reason they weren't?
Well, yeah, I mean, every practitioner out there, you're not 100%. You just are not. But yeah, we all have those kind of patients like that, and you're kind of like, well, what's going on here? What am I missing? So yes.
Well, I can't remember if we talked about this earlier today, but we are emotional beings, chemical beings, electrical, physical, electrical,
okay, I know what you mean.
and light. Yes.
Yep.
Anyway, so imagine I'm coming from the angle of electrical. If that electrical is not in the area of injury, it travels on the fluid of the body, right?
Correct.
So think about this. That's the blood flow. What's in the blood? Nutrients and oxygen, right? And the lymphatic, pulling the junk out.
Yep.
So if you have a blocked electrical, initially you would normally have blood flow coming to an area, say like a fire hose.
Yeah.
But when you have a block, it's now like a kinked garden hose.
Yeah, that's a good example for everybody right there. But yeah, I could really see that happening because you get patients that it's like you're just wondering what's the blockage or what's stopping them from healing.
Yeah. Yeah. And so if you haven't thought about this, look at the electrical side.
Correct. And I know like one of the things I always like to kind of show my patients, so they got this little magic glow ball thing where I can show them like how you connect together like that so you can see how we are electrical, like it's a circuit. So
Yes.
cells communicate
Yes.
that way. That's how they do it.
Yeah.
Same with your nervous system and other systems in the body too.
Yeah,
So-
and this technology actually is in your hospital. It's in sports medicine and in physical therapy.
Mhm.
Now, they're very strict on how they can use it. This is also available for those that have credentials like I do. We're typically picked up by the professional athletic teams,
Mhm.
by colleges, and they're starting to actually have high schools. If you have a high school that has the extra money, to bring us on, because it's all about rate of recovery.
Yeah, because they want to get those people right back out there as soon as they possibly can, correct?
Correct, on the athletic side, but think
Yeah.
about this. Outside of being, an athlete or the elite,
Mhm.
most of us are not sent to sports medicine.
No, it's like they come to somebody like me, and it's like my job is to try to get them back there as quickly as possible. Because, I mean, I don't know about you, I get a lot of people here saying, I can't miss work.
Yeah.
I got to get back out there right away. So I said, yeah, you're just like a professional athlete. We got to get you back out there so you can, make money, because a lot of people cannot be out for a week or two, like the 15-day disabled list like they do in baseball. You have to get back in the game right away.
Exactly. And imagine, we will see frozen shoulder. I'll just say this. Sometimes in as quickly as one session. Typically, we'll tell the person it's between 2 to 4, but often we'll see it in, one session. A range of motion change. Like if they're stuck here, we'll bring them up here.
Well,
now there's still a little more work to do.
Right.
But imagine we have a greater range of motion and a reduction in pain.
Well, that's great, because I mean, it's like that's one of the things, showing people objectively that you're getting better. If you can show increase in range of motion, that makes believers out of people, and same with the decrease in their pain too.
Yeah.
One of the ones I want to ask you about, this is something we talked about before, and it's like, could you tell me a little bit about how does this help with the different organs in the body? Because I do a lot of like detoxification for people to get help out the liver and the kidneys and the digestive tract and the blood. How does microcurrent therapy help organs function better and do their job better?
Well, for starters, we can see where there's any electrical blocks. We then can also see where there's inflammation. A lot of times you may not have inflammation at the site, but we can also tell if there's systemic inflammation. So then we
From the
go,
machine, right?
Yes.
The machine will, okay.
Yeah, the biofeedback. So imagine we then go in, we stimulate, we remove the inflammation first, treat any scarring, and we have to assume that there's scarring, because remember, the body it's always trying to repair itself. If you give it the right nutrients, it's going to be on this constant repair. But the first thing it does, it defends. So what you put in your pie hole here really matters.
Yes, it does.
If you're constantly putting in stuff that it has to defend off, then the nutrition cannot be utilized for rebuild. So with that, I want you to just imagine scarring. The body's constantly trying to repair itself. So the organs are the same way. And then they get tired. When there is a scar, it's not my opinion, it's factual, it blocks electrical.
Well, it's like a cirrhosis of the liver. I mean, that's all scarring of your liver. So that's a blockage, a big one. So this actually can help free up those blockages and get things functioning more properly and help with that.
Exactly.
Process.
So imagine we just, we open up that block.
Yep.
You give them the nutrition that they need, the whole food, and in high doses. There's enough not only for them to do their day, but now for the rebuild. And then we stimulate a little bit more. It's kind of like taking the organs to the gym. We stimulate them. They become stronger.
Liver workout.
Liver workout. They become
workout.
stronger. They are working more efficiently. They function better. The pancreas, think about, diabetes, or those with those high blood sugars, endocrine systems, there's really quite a bit. And inflammation. Inflammation's the biggest one.
Yeah, because I see a lot of problems with, liver, gallbladder, pancreas, and of course, their stomach digestion portion of it. Those are like the 3 top things I see all the time, Yvonne. It's amazing how many people have that problem.
Yeah, and sometimes they may not have pain here, but they have, as you know, organs that are not working efficiently. And inflammation is the precursor to pain.
Yeah.
Oftentimes in an organ, there's inflammation, but it's why they call it the Time Magazine had a front page said the silent killer because of what it's doing systemically.
So that's a great segue into this next thing, because I wanted to talk about chronic nerve pain for people, because I mean that's one of the things that we see often. You know, people coming in here with chronic nerve pain. So then how would this help with the microcurrent therapy? How would that help with the chronic nerve pain?
So when we talk about nerves, there's several types of nerves, and there's the A and B fibers, and then there's the C fibers. So many things can impact the A and B fibers, whether it's chemical or even some of those electrical stems. But the microcurrent, specifically the Avasia, offers pain relief on the C fibers. These are those 85%, they say, of people are C fiber pain. That is that long-term chronic that just doesn't seem to go away. So imagine that we can impact that.
Well, I can tell you, from what I've heard and seen some of your different videos and stuff that you've had on there, so, and this is probably a great time to show you guys a little bit of those videos about some of the testimonials that Yvonne has had with these people that are having these kind of issues. So let's take a look.
I've been having difficulty breathing for the past year, and I've noticed an immediate improvement.
Ankles aren't cracking anymore. My wrist, I've had carpal tunnel for about 20 years. The arm extension, I can't wait for my next visit.
I said, this is the furthest I've been able to turn my head to the right in 7 years.
Okay.
Prior to this appointment, I was dealing with a lot of pain in my knee. Lifting up my knee was really sharp here. I had surgery on my knee. I fully ruptured my ACL and then partially tore my meniscus, and so they did work on that. And when I lifted my leg, just like this, if it was any subtle movement like this right here, which is where my meniscus is, it started to hurt a lot. It was really sharp, so it was probably about a 7 or 6 in that sharpness. And now I don't feel any pain, so it's pretty amazing.
Donna, tell me what happened before your treatment and then it happened after. Maybe it was more like 7 or 10 minutes, but what happened?
I had very stiff shoulders and pain in my, what is that, quadriceps there? Yeah. And I couldn't do this, nor could I do this, nor could I do this. But now I could do it.
And did I hear you say it's been
Years I could not do that. Even in the shower, I have to brace. And I can do that. I could not do that before.
That's wonderful.
So. Wow, those are some great testimonials. So I'm really looking forward to having microcurrent therapy in our office too. So before you go, Yvonne, I got one more question for you.
Bring it on.
Now, when we're talking about the different types of units before, can you tell me a little bit more about what you meant by the waveforms of the units?
Certainly. So again, any engineer can create a microcurrent. Everything has a waveform. So we know if we're near a microwave. Do you remember those?
Oh yeah, I remember.
Stay away.
microwaves.
I remember working at the hospitals, and you didn't want to go there if you had ABC, pacemaker, etc. Then you've got radio wave. You've got the waveforms that are coming out of our cell phones, right?
Yeah, too, a lot of that.
All of those are waveforms. They are outside of what the body's waveform is, which is the technical term, this, biphasic sinusoidal.
Yep.
Oftentimes shortened for sinus or sine wave. Well, that's the one that the body understands. So if we talk about other microcurrents or TENS units, they are oftentimes either on a different waveform or a combination of waveforms. And that would include sawtooth, square, H wave.
Yeah, I remember all of these.
Yep. So those are you know, not speaking the body's language. So imagine,
Mhm.
you know, you're a dad.
Right.
You go in and you want to have your son pick up his room.
Mhm.
And so you march in there and you start yelling at him in Swahili. And I say yelling because the TENS unit is 1,000 times higher.
Yeah, they
So
really
you're
are.
yelling at him in Swahili. He's going to get up and he's going to start doing something, and he might do one or two things that you're asking, but he doesn't know because it's not communicating to him what
Right.
he really
That
needs.
is not his language. He doesn't
Exactly.
understand.
So a microcurrent on the sinus wave is like coming in and whispering in his language.
Okay.
And now
That's a
he
great way of
says,
putting it.
"Oh, okay, Daddy." And he gets up and he begins to pick up his toys.
Okay.
And
well,
so
that makes
because you've
sense.
communicated to him
Yes.
in a way that he understands. One of the other differences is we'll be constantly powering down. As the nerve endings become more responsive, wake back up.
Right.
Oftentimes they're dormant for one reason or another, scar tissue, inflammation.
Mhm.
We have to keep powering down.
Okay.
And
Okay. That makes sense.
unlike like a TENS unit, you have to keep powering up. And at some point, the tissue actually can be re-injured with a TENS unit, not with this. I might undertreat you, but I cannot hurt you with
Okay.
this.
Well, that's good to know, especially for the patients too. So, okay. Well, boy, I tell you, Vaughn, this has been a great time. I have learned a tremendous amount of information. I hope everybody out here has also learned that too. And if you want to add, microcurrent therapy to your current treatment therapy that we're doing here at our office, please give our office a call at 916-965-8171. And again, Yvonne, thank you so much for being here again today and talking with our patients.
Thank you so very much. I appreciate it.
All
Look
right,
forward to seeing
everybody,
you.
we'll see you next time.